Dear Katie, my name is Kumar. I live just down the street from your family. Due to all the seawater rise on the coast and subsequent riverbank flooding, there are now more mosquitoes in the village than ever before. They're not only being driven to the village due to flooding, the rising temperatures have also amplified the number of mosquitoes in the area around our village and caused them to move farther from the riverbank. Since my sister and I regularly fetch water from the river to cook and clean with, we often get bitten on our trips. Last week, out of the blue, my sister started to get sick. She had a high fever and was struck with intense chills, nausea, and body aches. Even though it's 40 degrees Celsius outside, she was shivering violently for almost 4 days. Since then, it's only gotten worse. Now she's starting to dip in and out of consciousness and her breathing has become raspy. She needs to inhale much deeper in order to properly breathe. Sometimes she says this makes it harder to stay awake in the short windows that she can, but in reality, she can't stay awake for more than several minutes at a time, and her lips are cracked because she's sweating out so much water. The only thing I can be truly thankful for is that the local flooding hasn't really done anything to the house yet. But you know, the quality of the houses here in the village, a little more flooding could destroy the foundation. They aren't like the houses in Bombay. You know that we don't live close enough to the city to get her there without a car, and no one in the village has a car, so it's impossible to get her to a proper clinic or hospital. But even if we were able to secure a ride into the city, the flooding has blocked off the main road into the village, and it would take several hours to get there. All we've been able to do is continue to give her water and pray for her recovery nonstop. But the water we gathered is running short, so I'm going to have to go back to the river to fetch more soon. I'm afraid that I'll risk being bitten by a mosquito too. Please come as soon as you can or get medical help here quickly. Sincerely, Kumar.
Dear Kumar, I'm going to contact a friend at the clinic in Bombay to help you get some medical supplies and attention. What I need you to do is continue to make sure that your sister is well hydrated and isn't running a really high fever. Push fluids to make sure that she doesn't sweat out too much water. I've been reading the news and it looks like the local clinics are swamped because sea level rises due to climate change have been causing flooding throughout eastern India and Bangladesh. Stay away from stagnant water because it's a breeding ground for mosquitoes. The local flooding has been pushing these mosquito populations farther inland. It sounds like your sister has malaria from her symptoms, but it might also be dengue fever or Lyme disease. They are similar insect-borne diseases. Like malaria, dengue and Lyme have not only been pushed farther inland, but the number of cases of these diseases has increased in your area due to warmer temperatures, increasing tick and mosquito breeding rates. Your situation is so frustrating because though your family contributes relatively little to the greenhouse effect that drives global warming, you are the one saddled with the deadliest effects since you have such poor access to healthcare services. I'm glad to hear that the flooding hasn't done much to your house, but you need to keep an eye out for it because it has already claimed 372,000 lives this year. Try to keep your sister indoors and in well-ventilated areas because the heat wave this summer also has had some nasty health effects like strokes and dehydration. Unfortunately, since you're in a climate-sensitive area, you have to be especially careful because you are going to experience the worst climate change impacts. These same natural disasters and diseases are far less deadly to the people who are driving climate change because they tend to live in climate-resistant areas and generally have better access to more effective health care. Hang in there, Katie.